Not tonight, dear. I have a headache. I know it's the old joke there that people use, but in many cases, a lot of people do have headaches that do affect a lot of their daily lives. And getting around to even such things as being able to have a productive and positive relationship with other people, getting your work done, being able to do something other than coming home and laying in a dark room or popping medication to try and quell whatever the pain is you have. There is hope here in the Santa Clarita Valley, but the Valencia Headache Center. Here with me this morning, Dr. Dean Schweitzer from the Valencia Headache Center. And good morning.
Good morning. Thanks for inviting me.
Well, thanks for being here, because this is really important. And I know people who have suffered from headaches. I know people who have suffered from migraines. And,
I did.
And
my entire life. Yes,
wow.
I did.
And is that what led you to kind of steer toward this, or?
It certainly was influential. When I became aware of this protocol, I dug into it very deeply. Because not only did I suffer from headaches, but my mom did, my son did, and like everybody else, I just basically put up with it and took my headache medication when I needed it, or Advil or Tylenol, and just somewhat accepted my situation. And you learn to kind of live with it. But it's very annoying, and it's very debilitating, and it changes your aura as a human. And when you're in pain, it's no fun.
So you're not just the doctor; you're also a client.
I was a patient, absolutely.
Well, and that's and prompting this though. This is a serious thing. We're talking about the bite related to headache pain. Now, how is a patient's bite related to headache pain? How does that coincide with your head compared to where your jaw is? There are two different spots.
Absolutely. Usually. When your bite's out of balance, it causes your facial muscles to be out of balance, and facial muscles are what control our bite. When our bite is out of balance, then our muscles become constricted, constrained, unhealthy, and that manifests as pain. Let me give you a visual that's going to really help you understand this. Imagine that you have a pebble in the bottom of your shoe, and every time you step down, it hurts. So your brain says, hey, don't step on that because it's going to hurt you. So it directs your leg muscles to step differently. So you walk differently until you can get to a point where you can take the pebble out. And once you take the pebble out, you're back on your way. Same thing occurs in your bite. If you bite down, your brain says, hey, don't bite there. But in a pebble, in a shoe, you can take it out. But what if you could never take out the pebble from your shoe? Then you would walk permanently in a very compromised way. All of your leg muscles, your hip muscles, your back muscles become compromised and sore. Same thing in your bite. You bite down, your brain says, hey, don't bite there, find a better spot. Problem is, there is not a better spot. So every day, every minute, every time you bite down, your facial muscles are straining to find a spot. That manifests as headache pain.
So how do you determine if a person suffering from a headache has an imbalance in their bite and it's not just something else?
We have to determine if the imbalance exists. So we use amazing digital technology that allows us to see every distribution of force in your bite, and we can look at that and use that as a blueprint to make some very small, very minor, very imperceptible adjustments. This is not dental work. We're not trying to fix your teeth or fix your bite or do braces. These are very imperceptible, very tiny, very comfortable adjustments that are made over a period of time.
So yeah, again, and having discussion in a prior interview, it's not major reconstructive surgery. I know people who have had those as part of orthodontia where they've had their jaws wired shut for amounts of time, and so there's nothing like that. We're really talking about a slow but not too slow. You're talking about 12 weeks, not bad.
Yes, over a 12-week period of time, we're going to balance your bite and rehabilitate the muscles. And at the end of that 12 weeks, and way before the end of that 12 weeks, by the way, people start feeling much, much better, to a point where somebody might have 25 headaches a month. We get them down to either 0 or maybe 1 or 2, and those 1 or 2 are very minor and very manageable.
We're talking about 25. That's every work day.
Every work day.
Or I mean, if you're thinking about that in terms, 25 out of 30 days on average a month is that's something that most people consider unacceptable. So this is a good opportunity. Valencia Headache Center, located here in Santa Clarita. Best way to get in touch with you?
Best way to reach us is call us. Our phone number is 661 and 287-9667. My staff's amazingly helpful, and they can set up a complimentary appointment for you to come in, and we can talk about your problem, and you can learn about how we can help you, or you can set up a full consultation where we can actually go through the diagnosis procedure and set up a treatment plan.
And either way, if you are suffering from a headache and you have tried everything else, and especially if you are taking medication or something that's not working, because that's treating the symptom and can also, of course, have negative health effects in the long term, right?
Absolutely. Most people just take medication or get injections or acupuncture. We're going to get to the problem and get rid of it. You're not going to have to take any of those anymore. And you can reach us at our website, too, valenciaheadachecare.com.
Outstanding. Dr. Dean Schweitzer,
Thank you.
Valencia Headache Center. Thanks for stopping by.